the first lecture of the first course of biochemistry for the second stage is the blood sampling. The introduction blood collection is of most importance for medical analysis, which are used in the diagnosis and prognosis of disease. The volume of the blood and the site of puncture are determined according to the analysis type and the number of analyses. The sample should be treated or not according to the type of the test. Generally, the main types of blood sampling are arterial sampling, venipuncture sampling, and finger stick sampling. The most common one of these is the venipuncture sampling. Venipuncture sampling is the most way to collect blood from adult patients. Collection takes place from the superficial vein in the upper limb, generally the median cubital vein as it showed in the image. This vein is close to the skin and does not have many large nerves positioned close by. Therefore, this vein is the most common used for the venipuncture. This reduces pain and discomfort for the patient. Venipuncture can take place in general medical practitioner office and is often carried out by the trained phlebotomist or nurse. This type of sampling is the most common for biochemical tests. The procedure of venipuncture: at first you have to position the patient in a chair of sampling as shown in the image. Wash your hands. Select a suitable site for venipuncture by placing the tourniquet 10 up to 15 centimeters above the selected site of puncture. Do not put a tourniquet on too tightly or leave it on the patient longer than 1 minute. You have to palpate the vein. When a vein is selected, cleanse the area by alcohol and a circular motion. Allow the area to air dry. After the area is cleansed, it should not be touched or palpated again. If you find it necessary to re-evaluate the site of palpation, the area needs to be re-cleansed before the venipuncture is performed. So the last step before venipuncture is the cleansing. Ask the patient to make a fist and avoid the pumping the fist. Hold the patient's arm firmly using the thumb to pull the skin taut to anchor the vein. The thumb should be 1 up to 2 inches below the venipuncture site. Swiftly insert the needle through the skin into the lumen of the vein. The needle should form a 15 up to 30 degree angle with the arm surface. When the needle enters the vein, the blood ascends by the capillary feature into the needle to the plastic transparent region to be sure that the needle inside the vein. At this point, do not push the needle and ask the patient to open the fist. Remove the tourniquet and pull the pistol. When you pull the pistol, the fist must be opened and the tourniquet must be removed. Number 9, remove the needle from the patient's arm and place goes immediately on the puncture site. The second way to sample is the arterial sampling. This type of blood collection most commonly takes place with a hospital environment. It is used in the identification of metabolic, respiratory, and mixed asbestos disorders where the carbon dioxide levels require understanding or monitoring. While generally safe, the procedure can be upsetting and painful for the patient. There are also several potential contraindications that can affect the site of collection, such as alcohol infection. There is also an increased risk of bleeding complication in patients with coagulopathy. Therefore, we said before that the most common way to balsamic is the vein puncture. The last way to balsamic is the finger stick sampling or finger prick sampling, which involves taking a very small amount of blood from patient. And we said before that the type of the test and the number of the test determine the type of sampling. It's over quickly and requires very little in the way of preparation, therefore reducing concern of anxiety in patients, particularly in children and nervous adults. We have many notes must be understood before the sampling. At first, you have to note that pumping the fist to enhance blood flow leads to a rise in potassium and magnesium due to increased muscle activity. And this will lead to false increase in the determination of potassium and magnesium levels. So if we want to determine the level of potassium and magnesium in the blood, we have to prevent the patient to pumping the fist. Do not leave a tourniquet on the patient's arm longer than 1 minute, because the prolongation tourniquet application may produce erroneous test results. We have another note: when the blood is collected from blood alcohol estimation, do not use the alcohol to cleanse the punctuary, and do not iodine tincture because it contains alcohol. If you want to determine the alcohol in the blood, you can disinfect the area of puncture with povidone iodine instead of the alcohol or iodine tincture. Thank you for listening.